Good afternoon, and welcome to another broadcast from the KNTV, Universal Family Connection. My name is Jeffrey Jones, and I am accompanied this time with my co-worker.
Ololade, Ademosu, good afternoon.
Okay, so we are thrilled to be back with you this month after this long summer. Today, as always, we're going to be talking about health education, and we're going to be taking your calls today. So this is a live broadcast. We will be taking calls. You can see if you want to call in, the number is on the bottom of the screen. That's 312-738-1060. Once again, if you want to call in, ask us a question, give us some feedback on the topic, we would certainly love to hear from you. As I said, this is Universal Family Connection. We are a social service agency located on the south side of Chicago. Been there for over 45 years, led by our founder and CEO, Dr. Lorraine Broyles. And so we're so pleased to be here. This is not our first time being on KNTV. It's been a while. The pandemic shut down a lot of things. But as I stated, we're glad to be back. We have a lot of interesting topics we're going to talk about as it pertains to health, as it pertains to HIV, hepatitis, the monkeypox, COVID, long-term COVID. So there is a lot going on in our communities that we want to make you aware of and give you opportunities to call in and give us some of your information that we may not know, so that we can disseminate it so that folks will be properly prepared to make the changes, adjustments they need to in their health journey. Today I want to start out talking about getting to zero in Illinois. Now, this is not going to be our only subject, but it's going to be one that we'll be talking about quite a bit. Getting to Illinois is an initiative here in Illinois, and it's throughout the United States. But here in Illinois, our plan is to eradicate, bring an end to the HIV epidemic by the year of 2030. Through our partnerships with people living with HIV, through community-based organizations, through advocacy with the pharmaceutical companies, we're all collaborating to make sure that by 2030, the HIV epidemic is a thing of the past. And you can do your part as well. How can you do your part? You can first off do your part by knowing your status. Many of the people who are HIV positive today are not aware that they are HIV positive. And so one of the things that myself and my team, Lade and Mary and Juliet, we go all throughout the city attempting to give people an opportunity to learn their HIV status. It's a free service. You can come into our office, schedule an appointment. You don't even have to schedule an appointment. Most times we're there in the morning, or you can call and see if one of us are in the building so that you can come in. The test takes about 30 minutes for us to do some pre-counseling and post-test counseling and talk to you about what next after you get the test, whether you're positive or negative. If you're negative, we're going to make sure that you are referred directly to an HIV care provider and get you on the medications that are necessary for you to live a long, healthy, and fruitful life. HIV is not something to be feared. We have made so many advances in the field of HIV prevention and HIV intervention that you can literally live with it, just like any chronic illness like diabetes or high blood pressure, any of those things, as long as you take your medication. We have what's called U equals U, meaning, let me digress. We have the medication is able, help me out, Lade, help you able to get you what's called
Get
undetectable.
able-
And so that means that,
Untransmittable.
right, so,
Yeah.
and so once you're taking the medications, they work so effectively that they eradicate the ability for the virus to be spread to someone else, even with unprotected protected sex. And so that's just one of the things we want people to know as we talk about getting to zero, getting to no new HIV cases by 2030. We should have no new HIV cases. And the folks who are HIV positive should be fully suppressed. What does that mean? That means that they're taking the medications on time every day as prescribed by their primary care physician. And as we stated, the medication does its parts and suppresses the virus to the point where you cannot even be detected. You can't find it in your system, although it's not a cure. It's the next best thing to a cure, and it can help you live a long and healthy life. And so that's kind of what we want to focus on as we get together month by month. We had a really great long summer. Just a lot of things took place. I see folks were traveling this summer. The heat was on. They say it was the hottest summer on record, and it's still hot. And so during those times when folks are not having a lot to do and they're just cooling out and enjoying the summer, there's the opportunity to have more sex. Sex is good. We believe in sex, but we believe in safe sex, sex that reduces your risk of becoming HIV positive. Some of the things that you can do to reduce your risk. Like, what are some of the things a person can do to reduce their risk of becoming HIV positive?
You can continue to wear condom.
Okay, so let me start right there.
Yes.
Condoms.
Yeah.
Using condoms, we know, is very effective. We need to talk more and more. We need to start speaking again because we got a lot of these commercials and marketing for the PrEP medication. We're going to talk about that, and we're going to talk about PEP as well.
Yes.
But we have all of those commercials for the PrEP, and that's great. It's effective. However, it has side effects that comes along with it, and we'll be addressing that. But with the condoms, there's no side effects. They're free of charge. You can get them almost anywhere. So many social service agencies distribute them. We distribute them at our agencies at no cost. So condom usage is very effective in stopping the transmission of HIV. And so we advocating condom usage. What else can you do?
There's dental dam for female.
Right. So right. So you
because
can use
it can be transmitted through anus or
through oral sex.
Oral sex
and
too.
right. So Lottie is talking about the dental dams. It's just like a condom for your mouth.
Yes.
It's kind of like just like a condom for your mouth, and so it reduces the risk. And don't you know that oral sex is less riskier than vaginal or anal sex? Let me say that again.
Yeah.
If you want to reduce your risk of contracting HIV or becoming infected with HIV, oral sex is a better choice. It reduces your risk greatly due to the bodily fluids not going directly into your body. So that's something that you consider. Also, abstinence.
Yes.
Right.
Number one
people,
protection.
right, the number one protector is abstinence. And they say, well, how is that possible, Jeffrey? Well, there's some other things you can do to have intimacy with a partner that you are attracted to, or you guys want to have casual interaction. It doesn't have to involve sex. It can just involve talking, touching, rubbing, a massage or a couples massage. It doesn't always have to lead to sex. And abstinence is still the number one way to prevent HIV. You say, well, that won't work for me, Jeffrey. I heard you. It won't work for you. Well, then try the condoms, and then if not the condoms, another thing you can do to reduce your risk, Lade, is reduce the amount of partners that you have.
Yes.
So if you are someone that practices monogamy or having one partner as opposed to 5 partners, no judgment, you can have as many as you want, but the chances of spreading or becoming infected is multiplied exponentially when you have more sex partners. And that's because that partner might be having sex with another partner who might be having sex with another partner, and you are in fact having sex with all of those folks that they may have come in contact with. And so you want to make sure that you're reducing your risk of becoming HIV positive. Let me stop for a second here and just tell you who we are. I'm Jeffrey Jones. I am the health educator, supervisor over our risk reduction department at Universal. No, not supervisor, manager. I was told to say I'm the manager of the risk reduction department at Universal Family Connection. And this is my co-worker.
Ademosu from Universal Family Connection.
And she's a health educator, certified in everything. We do HIV testing. We do hepatitis C testing. We do health. We do education. We attend health fairs.
We do referrals, counseling.
Right, we do the counseling. So we're doing our part to make sure that folks are aware of HIV, that it's not going away, that it's still an epidemic in the African American community, especially. Once the statistic says that we make up 14% of the population, but 50% or more of all new infections here in Chicago. So that's a scary number. And so it's our mission to get to zero. It's our mission to make sure that you are aware, and not to frighten you, to just inform you so that you can make a better decision. Yes. Okay, one of the things that I was talking with a coworker about, no, a colleague, this getting to zero, one of the things that we don't talk about a lot is PEP. Yes. And PEP is pre-exposure prophylaxis. What does that mean, Jeffrey? Pre-exposure prophylaxis means that if you believe that somehow you had sex the night before or within the last 72 hours with someone who may be positive for HIV, you can get a PEP pill on demand, and it destroys the virus's ability to replicate itself, so you won't become HIV positive. It kills the virus if, in fact, you have been exposed to HIV virus in your system through unexpected exposure. They use this in hospitals with the healthcare staff, because if they get stuck by a needle by accident, and it happens, they can use this PEP pill to make sure that they were not exposed to HIV from a patient.
And that is why you can always go to any emergency room to get PEP in case you feel like you are exposed to through sexual intercourse. So we want to talk more about this PEP pill, because we don't talk a lot about it, and like I said, we do more talking about PrEP, and we know that PrEP has
more side effects, and we started talking to men or folks, especially men who had used the PrEP, and they gave some reasons, why they stopped using it due to some of the side effects that were just a little bit too much for them. And so, but with PEP, you don't have to do an ongoing taking it for the rest of your life. You don't have to take it for so many days before it becomes effective. You can take it in the PEP pill within 72 hours. Can stop the virus from replicating in your system. So I believe that we should start talking more about the pre-exposure prophylactics and telling folks that, that if you even think that maybe you made a bad decision, sometimes, they say blame it on the alcohol, and you had one of those nights and you found yourself with someone for the very first time. It was a one-night stand, and now you're thinking that maybe this person seemed very, was somebody that could be impacted by HIV. You want to come in and get a PEP pill. You can call our office, or as Ololade said, you can go into an emergency room and let them know, that you need PEP. And what I'm going to try to do is for our next session, make sure that we have more information on where you can actually get PEP, because I'm not sure if you can get it at every location, every emergency room, but I'm sure if you got to an emergency room, they would be able, well, I can't even be sure of that, because some physicians and doctors don't even ask about HIV testing anymore. And so we can't take it for granted that these folks would even have PEP. I heard a story here recently about someone who was a healthcare provider, and they were stuck on the job, and their job was unwilling, not unwilling, did not have the appropriate medication necessary to provide them with PrEP. And I almost told the young lady not to, that it would be all right, that person did not have HIV. And she said, no, I want to get the PrEP. And so she finally got it, but it was just difficult for her, even being a staff member, to even get the pills. So we want to make sure that folks are aware of this PEP pill. It's called PEP, pre-exposure prophylactics. We're getting down to our last 5 minutes, and this is a live call-in show, so you have a few more minutes. We can take calls for a few more minutes, and the number is 312-738-1060. You can also find out more about Universal Family Connection through our website. And there's our website there. It's you can reach us at www.ufcinc.org. That's www.ufcinc.org. And you can find out all about what we do, all of the programs we have. We have over 20 programs ranging from the risk reduction, substance abuse, violence prevention, mentoring programs.
Youth service.
So we have youth service programs, child welfare, and so just a multitude of services located at 1350 West 103rd Street. We're located right in the Beverly area. We're accessible by bus right there on the corner of 103rd and Vincennes, right across the street from Percy Julian High School. If you're interested in coming in to take an HIV test or hepatitis test, these things are real. If you're interested in doing taking COVID testing, getting COVID vaccinations, getting monkeypox vaccination. We are partnering with agencies that can help you get those vaccines. So please give us a call if you're interested in doing the hepatitis HIV testing with us so that you can know your status. If you're interested in learning more about PEP, you can call us at our office. Our number is 773-881-1711. Again, our office number is 773-881-1711. We also want to inform you about a fair that we will be attending called the Renaissance Fair. That's happening on 79th and Racine, sponsored by the Auburn Gresham Chatham Business Chamber of Commerce. And that's on this Saturday, September the 9th. We'll be there doing HIV testing, a lot of giveaways, vendors, food, entertainment. Please come out. That's this Saturday, September the 12th. It begins at 12 o'clock, 12 until 8. So, yeah, come on out, have some fun, get tested. Going to be a lot of free giveaways. And as we wind down, just want to let you know that HIV can be defeated. It will be defeated by 2013, but it won't. We can't do it alone. Yes. We need your help to get tested. We need your help by learning more about safer sex practices, less risky practices, and just getting the information out. That's really important. If you have any questions, please feel free to call us.
Ask us how you can test.
And
how you can get tested.
Right, how you can get tested.
Yes.
And our number on this show, even though we're no longer taking calls, we ask that you would meet us back here. Our next day is the first Wednesday in October.
Every month.
Of every month. We'll be back same time, 4 o'clock p.m. Have any questions, you have any suggestions, topics that you want to hear about, call us at the office, 773-881-1711, or you can visit us at our website. That's www.ufcinc.org. I'm Jeffery Jones. I'm the health educator, Universal Family Connection, along with my colleague,
Ademosu, health educator, Universal Family Connection.
And answering our phones today is our colleague, Mary Turpin, who's here with us. So I want to appreciate you guys for giving us an audience, for being available to listen, getting the information, and we look forward to seeing you again in the very, very near future.
Yes, we hope to hear from you soon.
And we hope to hear from you very soon. We got any parting words? You have any parting words, Lade? Well, get tested.
Get tested.
Get tested.
Ask us, how can you get tested? And we have, for anyone that is positive, we link you to service right away.
Right away.
Right away.
Right. And if you have an organization that does not do HIV testing, we're available. And we're located on the south side. We have 2 locations, one here at 1350 West 103rd Street, and then we're on
7949 Southwestern.
7949 Southwestern is our second location. But we can go all over the city. So if you have an event planned and you want someone to do HIV and hepatitis testing, please give us a call. And we will make arrangements to bring our staff out. We also have a mobile van that we do testing on. So if you want us to bring our van out and do testing, we're available to do it that way too. Thank you so much for being here with us today. Enjoy the rest of your last days of summer.